The math behind COVID-19. You may have heard a lot about COVID-19, the virus that caused countries around the world to shut down. But wait a minute, why did countries shut down and start enforcing social distancing? I mean, the entire world doesn't shut down during flu season. How is this any different? Well, to answer this question, we will look at and compare COVID-19's infection rate with other viruses, as well as discuss the models that researchers came up with to help us battle the virus. So, let's get started. COVID-19 is a virus that is caused by the novel coronavirus, also known as severe acute respiratory syndrome coronavirus 2. This is a mouthful, but what makes this virus different from the others? Well, COVID-19 was first reported in December of 2019. From there, the situation quickly escalated, causing a global pandemic to be declared. The reason for this was how quickly the virus spread. When it was first reported, the virus was spreading similar to the flu, but doctors and researchers quickly realized that that was not the case when they studied graphs that showed the growing number of COVID-19 cases. The numbers were increasing exponentially, and unless there were restrictions, policies, or changes in our everyday life, there would be continual exponential growth. Now, why is this bad? Exponential growth is the same thing as saying a certain number of something is doubling over a certain period of time. For example, you start off with 2 dust bunnies in your room. Then in 3 days you see 4, then in another 3 days you see 16. This is the only way to stop the exponential growth is to take action and sweep them up. The same can be said for COVID-19. The only way to stop the exponential growth of the virus is to put measurements in place. This led to social distancing policies meant to flatten the curve. Flattening the curve means reducing the number of infections as to not overwhelm the hospital system. Overwhelming the hospital system can be dangerous because sick patients will not be able to get help, and this can lead to an increase in deaths. Scientists realized that this could be an issue and developed models which were then used to inform medical and political decisions. The first thing scientists did is find the basic reproduction number, or R0. This is an estimate of how many people can catch the virus from one person. So if R0 is 3, that means one infected person can spread it to 3 other people. This number changes based on where you live, but many scientists believe it's between 2 and 3. Models use R0 to show the importance of social distancing and implementing it in a timely manner. If measures aren't implemented, then a large percent of people can be infected. This can be seen in the US, where currently over 2 million cases have been discovered. The CDC and different scientists develop models to help inform important decisions, and the COVID-19 models will become more accurate with time. Currently, the models are limited, but one thing we do know is that we must socially distance, wear a mask every day when we're in public, and wash our hands. The CDC and the World Health Organization have put out guidelines on how to stay safe, so head over to their website if you want to learn more.